Have a talk with our gentleman that brings us the amazing Silver 100, but we'll get him back on another program. I want to talk about some of the interesting new consults I have, and we do get some really quite amazing requests. Give you an example. I had one of our customers, new customer actually, that listened to the program but knew, in that she had not ordered before for her daughter, that was seeing a conventional doctor for Lyme disease. Now, I just want to give a little bit of a mini talk on Lyme disease. Lyme disease is very common. There's 34 Lyme-like parasites in North America and North Europe. The three different classes are Lyme, babesiosis, and ehrlichiosis. The best lab for testing that, there's two different types of tests. One is called the iSpot Lyme test that measures a thing called IFN gamma. If IFN gamma is present on this test, it's very accurate. It will tell you if you have an active illness. If you have the signature present of antibodies, it means you had a current or past infection, but it doesn't tell you if it's currently causing your lymphocytes to produce specific cytokines that are related to a lot of the Lyme side effects. Lyme disease affects your neurotransmitters in your brain and mitochondrial function, and the overall cytokines causes increased inflammation of tissues, which does cross the blood-brain barrier, as many biological effects. Now, Lyme is expanding and affecting pets and also children. So this lady is pretty certain that not only has she shown positive on her immunological testing with her doctor was going to give her that, and she, of course, has problems with fungi. Now, when I've done testing at advanced immunology laboratories like Immunosciences, previously in Beverly Hills, but now in Los Angeles, with Dr. Aristo Vujadani, the average person that has a positive Lyme test has 4 to 5 other pathogens like cytomegalovirus, Epstein-Barr virus, etc., a signature that they've had at least a past infection. Many times they're also, because of their weakened immune system, they're sitting doc for anaerobes in their lower gut, fungi of various types, and they are mold illnesses, whether it's chronic sinuses or sinorhinitis or bronchitis, and even various pathogens in their gut like Helicobacter pylori. You can actually do blood tests and urine tests and stool tests and DNA probes and so on to prove these things rather than just conjecture. I tell people the most important test is the iSpot Lyme. You can do the Immunosciences test for the multiple panels. You can spend, I think, $200 or $300 just on the immunological test with Immunosciences. The iSpot Lyme test, I think, is about $150. I tell people if you want to get a baseline, you do not need to use drugs. They were going to give her Sporanox, which is an antifungal, and another antifungal medication. And they're going to give her 2 antibiotics, minocycline and another antibiotic that is relatively useless. These antibiotics, firstly, number one, the organisms get resistant to them very quickly. They do not penetrate through the biofilm, but bacteria and other pathogens. And because of that, you develop resistance really fast. And so in the long term, you might get temporary improvement for a month or two. And then if you take, quote, antibiotics, and the second thing you get is an overgrowth of anaerobic bacteria because they work in a very narrow spectrum. So my approach to Lyme disease is threefold. You have to kill the pathogens, you have to restore mitochondrial function, and you have to restore neurotransmitter function, as well as support the tissue's healing. And the short part, we call the initial introductory protocol, is to use our triple threat, which is Nutridyne, Allicin Med, Silver 100, and then our antipathogenics, augmenting with immunoglobulins like Nutrimune and NutriDefense, extremely important. Secondly, you need to reduce the cytokines, and we have a new special curcumin. And by the way, those people are waiting for their cell defense. We have a new upgraded delivery system that's far more powerful. So if you have no standing order, just bear with us. We will ship you at no extra cost this new delivery system, Cell Defense. It's amazing. It's the most powerful, probably the most important nutraceutical advance in decades, because the most important nutraceutical on the planet is curcumin, but it is extremely poorly absorbed until this technology. Cell Defense in its older technology was very good because it had bioperin, which increased absorption a lot, but this new technology is heads over that. So Cell Defense, you want to be also able to turn off the inflammation with Inflamex. You want to restore the lipids in the tissue, so you want to use Neurogen Minerals Plus for healing the tissue, and Collagen Max is interfered with collagen synthesis. You want to use, perhaps to improve mineralization, Indiamese. You want to stop the free radicals, which is Cell Detox Glutathione, Anti-Age Max, and Nutritrala. Those are extremely important. To turn off the cytokines, and remember now, Lyme disease can trigger off an autoimmunity too, so you start to getting anti-tissue antibodies. A ketogenic diet, you can use mild hyperbaric oxygen, especially for mold, for the brain fog, etc. And you can use Cognition Plus, Brain Power, Synaptin, which is a little brother of Cognition Plus, and then our mitochondrial support. We start off with Nutriodine, most important Nutriodine, what's called NADH, which is nicotine adenine dinucleotide hydride, D-ribose. We also have, for special order, what's called the Cell Energy, which is the most powerful form of carnitine, called acetyl-L-carnitine. It works particularly in the brain, but it works within minutes. ALC 1000, I call Cell Energy. That's a special order. We have, of course, mitochondrial catalysts and and what's called the uridine, which is a triacetyl uridine. So we have a whole range of things, including fatty acid improvement metabolism with Her Majesty's Royal Jelly. And you can massively increase mitochondrial function and improve what's called mitophagy, where you get rid of old damaged mitochondria because they're damaged by the stealth pathogens that are intercellular. So now you're supporting the cells. You're supporting stem cells with things like our myco-D2, which is ergothioneine, micelle D3, which is important for stem cells. They don't work without vitamin D, D2 and D3. With things like Collagen Max, Mountain Red Velvet, with 296 biomolecules and 6 growth hormones, including IGF-1 and many others. Don't just buy IGF-1 alone. The fools that are selling you IGF-1 are probably extracting it from blood of deer, which means they're probably slaughtering them. And they're only using IGF-1 without all the other growth factors and building blocks. That's not healthy. So do not buy, I think there's a product out called Royal Velvet or something. Don't use that. Do you want to use Mountain Red Velvet? We are working to try to improve the delivery system, and I'm trying to get approval for Fish and Game to encapsulate here in America newer capsules that'll deliver more to the terminal small bowel. In the meantime, just open the capsules under your tongue, one at least twice a day. Our people that follow our protocol, and we can tweak it and adjust it, notice that their IFN gamma should go negative. So it means their T lymphocytes are now not being turned on. If they have anti-tissue antibodies or anti-nuclear antibodies developing, trying to turn it into an autoimmune condition, if they do a quantitative EEG, electroencephalogram, their brain fog and their brain dysfunction will go away on the quantitative EEG. We can measure organic acids for metabolism of their mitochondria and show it's improving. So there's lots of quantitative ways of proving these are non-invasive to determine if you're getting better. Like a QEEG just involves dull electrodes. Most of the tests are urine and or blood for looking at organic acid metabolites. And we can simply repeat the IFN gamma test and the antibody levels, but the IFN gamma is most important to determine if the Lyme disease is going away. So, in other words, I've been doing this kind of work for decades, and we're doing it before even these other labs like Genova, Metametrics, Doctors Data were available. And collaborate with these guys using university research labs. I started doing work on antibodies to Candida albicans 36 years ago at the University of San Francisco. We would send off special bloods to look at various different classes of antibodies. We now have new ways, and we're working on new ways to actually modify the immune system. We have an immunoglobulin product that will be coming out this year that we had issues with taste before, and we're always trying to make sure that taste, if you're mixing it in a smoothie, it's great. It is an immunoglobulin product from Avian that actually covers all the major pathogens. That will be coming out as well sometime this year. Don't vaccinate, and don't think you have to get a, quote, a physician waiver. All you have to do is just refuse to do so because they can't, quote, they call it mandate. Mandate doesn't mean you have to do it because you're not in a police state. And they can't refuse to have your child in school, so and you can file pro se litigant suits against the physician, the school, the teachers, and the health nurse. That's what you need to do. You need to not ask for a waiver, which is asking their permission. You need to refuse and file pro se litigant action. We'll be back in just a moment. Your questions on any topic, open lines 800-259-5791. We'll continue on wellness issues and consults, and then we'll pop in some news. And of course, that's a little intro from Steely Dan, The Last Mall, which if we want to hear the lyrics, is quite funny. We'll play it sometime. We have a request regarding a gentleman who is outside the country. He has MS, and of course we have him on a current protocol to try to keep his MS stable and keep his energy level high. Nutrimune, Cognition Plus for his brain, Arrival to stop the MS fatigue. Their bromocriptine was the older drug that doctors would use to increase dopamine levels, which help to counteract the MS fatigue syndrome. To remyelinate his nerves, we use sphingolin, which is myelin basic protein, and neurogen, docosahexaenoic acid. To calm his activated nervous system, because when you're under stress, you often have agitation and difficulty with induction of sleep and so on. Calm Mind and Brain Mag, which is very neuroprotective of inflammatory changes in the brains, which are increased in people with multiple sclerosis. So that gives you an idea of some of the support. We have other things for this gentleman, but that gives you some of the basic ideas. Autoimmune diseases we can treat with a ketogenic diet. Our protocols for the starting regime for both cancer and autoimmune disease are identical, and we can put it in remission without the use of disease-modifying drugs. I get some funny requests sometimes. I had one here. The person has 2 guinea pigs, almost a year old each. And they want to know if there's any supplement that can help resolve the most common guinea pig diseases, including respiratory infections, diarrhea, scurvy, vitamin C deficiency, of course. By the way, cataracts is a vitamin C deficiency state. It may be you can stop regular scurvy, where your old lesions and skin breakout, but if your vitamin C level is high enough, you won't get cataracts. You can also take delinking agents like our carnosine and Nutritrala and cell detox glutathione to get rid of singlet oxygen. Because remember, the primary chain that causes, for example, in regular people as well as animals, that causes things like diabetes, which is now prevalent, is basically a mineral deficiency that triggers off a loss of superoxide dismutase, and you get free radicals. They trigger the release of cytokines like leukotriene B4, and that causes increased tissue resistance to insulin and leptin, and that causes hyperinsulinemia, increased glucagon to turn protein into sugar in your liver, and increased stress in your adrenal glands, because cortisol is the primary hormone that counteracts high insulin. So you get in basically like a Cushingoid syndrome from hypercortisolemia. So let's talk about, firstly, I would say, depending on the size, if you have guinea pigs, you can use your antipathogenics. We have Nutridyne, Allicin Med Silver. I would probably dose it, for example, if your guinea pig is like, 5 pounds, you'd be giving at least 1/20th the dosage you would for an adult, maybe just a couple of drops 3 times a day of Nutridyne. Diarrhea, you want to recolonize their gut. You can usually, believe it or not, their gut is not that dissimilar from ours with living probiotic, and a little bit every so many months a week, let's say, living probiotic ultra. Scurvy, you can actually just put a little sprinkle of our special neutral pH calcium, magnesium, sodium, potassium ascorbate with BioPerine and vitamin C. Tumors, you can use our malignant block, that is, ellagic acid and full vitamin K2, and it'll prevent tumor transformation. And of course, we already mentioned antipathogenics, and you can use also our NutriDefense. Just open up a tiny portion of a capsule, 1/5 of a capsule. Urinary problems, bladder stones, calcium, magnesium citrate, which you can put a little bit of sprinkle in there. Food will stop the formation of bladder and gallbladder stones. So bladder stones you can stop with magnesium potassium citrate, and also BioLVR, which will stop the types of stones that are triggered off by methylation pathway problems. Infestations by lice, firstly, if you're using our thiol compounds, Allicin Med, you can give a tiny amount, like 1 capsule lasts a week for a guinea pig. Mites and fungus, and these antipathogenics will kill all those things off, and you can also spray their skin with Silver 100, and voila, you have healthy guinea pigs. So in other words, the same principles can be applied to humans, whether you've got psoriasis and you've got tons of pathogens on your skin from your mites, or you've got little cute guinea pigs, which are, believe it or not, genetically not that much dissimilar from humans, maybe 1.5% of their DNA. Yeah, amazing. Strange, but amazingly true. I had an interesting question. Sometimes people ask me, can I find a functional medicine doctor in their part of the country? If you go through our academies, the American Academy of Advancement in Medicine, ACAM, acam.org, or the American College for Environmental Medicine, American Academy of Environmental Medicine, AAEM, online.org, you can probably find somebody in your part of the country. A lot of the doctors, though, that are listed are relatively new to the whole science, and I will act as a mentor to help those cases. So if you're trying to look for a doctor in your part of the country, this gentleman here had problems with, let's see, he wanted to have, of course, the essential products, and of course we tell people we'll cut it down as much as we can to keep within your budget. He had been on a number of other supplements, which are, some of the multi-level. Please don't do that. You're just going to get yourself into trouble. And don't think you're going to make money trying to become a so-called pseudo-expert in this. If you listen to the program, you can become expert enough to at least start your initial programs, but you need to know what conventional advanced testing and other things to do. This is functional medicine. It's more advanced than even regular medicine. So you're not going to learn this whether you're a chiropractor, a naturopath, or herbologist. It's way more advanced. You don't know how to read an MRI scan, CT scan, genetic analysis, organic acids, metabolites, immunological parameters, quantum testing, and so on, like QRMA or bioplasm. So forget it. I'm here to help you and to train you up, and I'll train doctors, but, don't start thinking that you're going to create a universal program with just a couple of things that you're going to get in a multi-level. It's a waste of your time. And the best thing to get in if you wanted to get into a network is carrot bars. You're not selling anything, you're actually exchanging money for. This particular gentleman had a lot of issues going on. I think it was compartment syndrome. And I just put together, a very extensive protocol, and then I had to cut it back. But here's the protocol. He developed a very serious forearm pain. He was doing some form of martial art. I recommended that they do a soft x-ray, which will pick up the little cracks in the periosteum. You can see, and an ultrasound of the compartment to see if he doesn't have a serious compartment disorder, because if he does, it'll actually compress the nerves enough that you'll start to lose your A delts and C fiber function, which can cause pain. You'll also can eventually cause dysmyelination of motor fibers, so that's not good. You can get atrophy. Inflamex is very important to start with. Cell defense, our new cell defense is amazing. I mean, you really want to get this. 4 capsules to 5 capsules twice a day of Inflamex, and I would say 1 capsule 4 times a day to 2 twice a day of the new cell defense. Tendon mender to stop the tenocytes and the compartment syndrome, 2 capsules twice a day. Joint performance, 2 capsules twice a day for the intercarpal bones of the wrist and the elbow. Collagen Max to speed healing, triple the rate of the proline transhydroxylase. Mountain Red Velvets is applied to bionutrients. Bone generator for the osteopenic bones from the excessive activity. And MyCell D3, 5,000 unit soft gels, and MyCoD2, at least 2 soft gels twice a day in the advanced protocol. Power C Plus to alkalinize the body, which helps to diurease out the fluid from the compartment. Full vitamin K2 to speed the formation of bone. And stop free radicals, cell detox glutathione, topical pregnenolone and curcumin cream, a deep tissue massage, and lumen photon setting 7 for inflammation and NICO for healing. Welcome back to the Nutrimedical Report. The interesting thing is how many consultations have covered new topics that I'm totally surprised at. We had a request regarding type 2 diabetes, which we often get questions about. And some people are trying to say, well, what would help diabetes? So the first 3 core things are, number 1, diabetoline, usually 1 to 2 capsules twice a day. Number 2, glycemics, which includes also the component we used to have in Carboblock, which is now discontinued because we found that people were just taking the glycemics. There's no need to have it separate. And number 3, leptin metabolic, which actually will change your insulin resistance. The 4th thing to add would be biotin plus and chromium cruciferate. And if you're trying to mobilize fat, because the elevated insulin will cause fat storage, that's why everyone who's obese basically has a hyperinsulinemia problem. And by the way, for treatment of diabetes, you don't want to take any drugs or insulin injections because you can't lose weight when you do that. In fact, after the Second World War, when they wanted to put weight on people that were starving in detention camps, they actually gave them insulin injections with porcine or pig insulin and zinc and porcine insulin. The Lilly Corporation was one of the first to discover that. So I know Benting and Best personally that discovered insulin back in the 1920s, met them because they were in a medical school back in the 70s. What you want to understand is that our protocol is very effective. I recommend that you switch to using glycemics as a smoothie drink. What I do in my drink is I put glycemics, Life Support Ageless. I'll put some other components in there as well, like Nutriodine and Cardiovasc Liquid. But I think it's really, and Nutriodine. But I think it's important to understand the core is the glycemics. It will lower your blood insulin, your blood sugar, and glucagon. It'll smooth out your blood sugar. It'll also reduce free radicals. And then, of course, remember the underlying cause of diabetes is mineral deficiency. So we use Indiamese to optimize minerals. We use the chromium cruciferate Minerals Plus and Vitamineral Max. And to reverse end-organ damage, we want you to be taking Cell Detox Glutathione, and Nutritrala, and Anti-Age Max as well, to stop free radical damage, and more importantly, our new upgraded Cell Defense, which is now I consider one of the most important nutraceutical advances in decades. This new delivery system and new power to turn off inflammation, protect DNA, and turn off autoimmune disease and precancerous cell changes is amazing. And that combined with Inflamex, because diabetics tend to get tendinitis, bursitis, and arthritis, so Inflamex and Cell Defense are core. And you need probiotics because diabetics are also 6 times more likely to not only have a vascular event, but also to have dysbiosis in their gut and have increased risk of colon cancer. So Living Probiotic and Living Probiotic Ultra are important. Berberstatin, and of course our antipathogenics, Nutridyne, Silver 100, and NutriDefense, Allison Med. Now, so if you want to stay healthy, we can measure your oxidative markers, we can measure fructosamine and hemoglobin A1C. Our protocol, though, is very important because basically, if you don't protect your brain cells, Alzheimer's is primarily diabetes of the brain. I call type 3 diabetes is Alzheimer's. You won't hear many people saying that, but if you delve and talk to the neuroscientists doing research, they'll tell you that's absolutely correct. The astrocytes lose their mitochondrial function. You can use medium-chain triglycerides like coconut oil to improve brain function, someone who's getting pre-dementia. But ultimately, you want to increase mitochondrial function and improve insulin sensitivity, which our protocol will do that. We can also give you things like Cognition Plus Brain Power and things like BioLVR, Superfolate, Powermethyl B12, and Semethyl that increase your neurotransmitter conversion rate, along with things like our Indiamese, which will help your increasing neurotransmitter rate. And the deficiencies of release of melatonin, very important to take our melatonin TR. We're working on some other on a sleep induction and maintenance formula as well that'll be coming out shortly as well. So we're always working to improve our protocols. We're always improving our products, but the biggest advance lately is Cell Defense. That's a really big change, Cell Defense. Just also to mention, we're getting a lot of requested information from my talk a few days ago about our new technologies for ozone. I had a gentleman this morning I talked to back in New York. Our ozone machines generate ozonated water. You want to have clean water, either pure water system water, bottled or filtered water, or distilled water. You do not want to ozonate water that's not filtered. You can use it as ozonated water to drink. It'll clear your pathogens from your body and your gut. And you can also use ozonated enema water as well. Now, the other thing is you can wash dishes with it and wash your food to kill off the pathogens. We also have a IONIC filtration system that's a plasma air filtration system that's really excellent. It'll pull out the toxic chemicals as well as mold and other things from the air. And we have a ion detoxification system that'll also help with weight loss, toxin removal, far more advanced than just the foot bath systems. This is a very advanced technology. And of course we have the Bioplasm Expert and Clinical. These are primarily for clinics because they're more expensive technology. They will can do methatherapy or frequency treatment. They can create nosodes or basically imprint frequencies into a fluid. They can do a treatment of you with these special hydrophones, and they can identify with equal accuracy or more than an ultrasound, X-ray, CT scan, not only the name of pathology, but its anatomical location. So they can tell you what pathogens you have, where you have a blocked artery, where a specific tumor is. It's just amazing. And if someone gets a bioplasma machine, I log on to TeamViewer 10 and we'll do an analysis of your data. The bioplasma machine, I charge for my time to do it because it's quite extensive time. When I do a full bioplasma analysis, if you do a full analysis, it can actually take up to 2 hours on the machine to actually do a full body analysis, right down to your genes and biological molecules in your body and hormones. There's nothing like it. The Russian Space Agency developed it under Dr. Nesterov over the last 50 plus years. It's the most advanced diagnostic quantum technology on the planet. I love the QRMA because it's quick. 1 minute test, you can tell exactly what your nutritional deficiencies are and your organ function, if it's okay or not. A lot of time you'll get unusual results, like they'll be way off scale. When you're first starting and your tissue energy level's low, you may not unveil problems, and as we start to increase tissue energy, you may start seeing unusual results pop up because now the tissue energy is high enough to demonstrate a significant imbalance. if you send those reports to me, if you've purchased a QRMA machine, I can give you an analysis and tell you what you need to change. Most people will need only 1/3 of the supplements they started with or thought they would be if they were not doing a QRMA on top of their functional medicine. So it saves you a lot of money. It also targets exactly what you need now compared to 6 months ago or a year ago. So it makes a huge difference. You can also confirm it with functional medicine blood tests. Someone asked about questions for the pineal gland. We have basically three things. Nutridyne will help remove the fluoride and halides. Indiamines will help remineralize the pineal gland. And the third level is to, of course, use our Minerals Plus Vitamineral Max, which is very important for mineralization. You want to stop free radical damage in the pineal gland with Cell Detox, Glutathione, Nutritrala, Anti-Age Max. What we also have now is access to peptides that modify your DNA for cell and tissue regeneration. This is more advanced even than a regular stem cell transplant, because the stem cells, quote, from current research don't take, but the biological molecules that modify the DNA do work. You just have to, if you consult me, we have now molecules from regenerating your pineal gland, your liver, your kidneys, your brain, your teeth. We have specific peptide molecules that are in combinations will modify to turn on your DNA to reactivate your stem cells for specific organ systems. And this comes out of research from the Russian Academy in St. Petersburg and other scientists in Europe. So we have access to these now on many, many other anti-aging molecules. So what you want to know is that if you do a consultation, I have access to clinics around the world and to advanced technology you can do at home. They're a fraction of the cost of going for, say, a stem cell transplant. It just involves taking a small capsule twice a day, which you can even make into a smoothie or take sublingually under your tongue. No injections, no big travel, no expensive treatments. We'll be back in just a moment with more questions. 800-259-579. And welcome back. I got an interesting question. It was a question regarding skin cancer, and they want to know about how much Nutridyne should be given for adults, children, babies, prenatal for regular radiation protection. Well, firstly, you're taking Nutridyne for three reasons. The first is you want to counteract radioiodine 131. The second reason, you want to improve the removal of damaged mitochondria, which is called mitophagy. And the third reason why you're taking it is to remove other halides, so chloride, fluoride, and bromide from the body, because if you don't have the energized form, there's people that are selling various versions. They call it nascent, which is a diatomic form, or other forms of iodine. These do not have the biological effect of a monoatomic Tesla-activated plasma superconductor form of iodine called Nutrimedical. Nutrimedical has a number of properties. It kills all pathogens. It removes the higher energy naturally molecules fluoride, chloride, and bromide, because Nutrimedical is a Tesla-activated form, so it has a different harmonic or resonant signature. So the dosage I would recommend to start with for basic protection for an adult is about 10 drops twice a day. If you take a child, depending on their weight, you just take a fraction of that. So an average adult, say 150 pounds, and a child, say 50 pounds, you give 1/3 of the dosage, or 5 drops twice a day. For babies, the same thing. If a baby is, say, 20 pounds or 15 pounds, you give a fraction of maybe 1/6 of that dosage, or 3 drops twice a day. Prenatally, mothers actually not only protect their baby, but they also stop decreasing numbers of mitochondria, which also decreases the number of neurons. In fact, what happens is the deficiencies of things to protect the brain, for example, iodine deficiency can cause microcephaly. People think of microcephaly caused by Zika virus, but typically if your levels of iodine are low, your also levels of activated T3 is low, you'll have decreased number of actual neurons developing in the brain. So I recommend a mother at least take 10 drops twice a day. So that gives you the basic dosage there. If you have a serious pathogen, let's say an acute pneumonia or herpes zoster, like infection, like shingles, you want to bump up the dosage to 20 to 30 drops every 3 to 4 hours, so 4 times a day. And that'll have a major, major effect. You can also make it and dilute it and put it in a Sinupulse Elite for sinus irrigation, 30 drops in a chamber of 800 mils. You want to have pure water system water or distilled water, add a sachet of Sinu air powder, and then you want to add on top of that, for the sinuses, you want to take nasally, probably the vertical nasal spray. And to stop allergies, I would recommend high-dose Power C. Allergon, and Allerblock. The Allergon actually is very unique. It's the only enzyme available in the world to actually get rid of histamine and inflammatory cytokines. So that gives you an idea of how to approach that particular issue. Also, when you're trying to fight skin cancer, the first thing I recommend, remember now it's only ultraviolet light that forms freckling and skin cancer. The light at the end of the day, where it's still warm, it basically is infrared light. So it's not going to do the same thing for skin cancer induction. I recommend to protect your skin from skin cancer. Number one, you put on your body a curcumin cream, which actually will repair the DNA, and pregnenolone. Those two creams, curcumin and pregnenolone, will help reverse DNA damage. And then you can take internally ellagic acid, malignant block, and full vitamin K2 and power C, because the electrons will prevent the oxidative stress in the skin. Remember, a lot of natural molecules in your metabolism and or drugs you take. Some doctors aren't aware that many of the drugs they give to people are not just photoactivated, they can increase a burn, they can actually cause cancer induction in your skin. So a lot of the medications that people are taking are one of the primary increases of skin cancer is because they're photoactivated, including, by the way, biotoxins that are present in their food can be photoactivated too. So sun doesn't cause skin cancer, it's a lack of repair. So if you have adequate levels of selenium, cell detox, glutathione, Nutritrella, things like our curcumin tablets or new cell defense, you can block and prevent and reverse the DNA damage caused by oxidative stress from sunlight. So it's a matter of a balance of repair. Sun, in fact, in many cases, if you're taking the right nutraceuticals like vitamin D, micelle D3, etc., myco-D2, and the things for cell repair and oxidative stress, the sunlight will not cause skin cancer. So it's a misnomer. It's photoactivation of biotoxins, chemicals, and pesticides, etc., in your food that course through your blood and are photoactivated to be called cancer-inducing biotoxins. Let's see now. People ask about Silver 100. Can they spray it directly in your eye? Yeah, you can, but you can use the drops. It's either one. Now, if you're trying to stop floaters basically are called asteroid hyaloses. They're basically little oxidized little blebs of hyaluronic acid. What I tell people to do first off is take our Vision Max, Can-C eye drops, and cell detox glutathione, use the Silver 100 to deal with any stealth passages in the eye, and get a lumen photon, and you want to put it on setting number 7 if there's increased intracranial pressure, say for 15 minutes to half an hour, and then setting number 3 to stimulate healing. As you reduce the oxidative stress in the eye, the floaters will go away because it's oxidative stress on these little bubbles. They call them soap bubbles or asteroid hyaloses, or basically what it means in Latin is floating stars. Hyaline stars of hyaluronic acid that actually look like little stars floating in your eye. That's what the fancy ophthalmic term is. Let's see, we had a question here. Let's see. Yeah, we had a question from somebody with osteoporosis, osteopenia. Okay, this is a nasty case. This was very interesting. What happened to this lady is she actually had been walking around, I think, Disneyland, and she shattered her leg. The orthopedic surgeon put an appliance in, but didn't realize she had poor bones, and of course the appliance shattered the rest of the bone and made a disaster. What you want to do is real simple. First off, bone is not just dense bone, so a bone densitometry scan can deceive you into thinking it's strong bone. It's like building a bridge without rebar in it. If you don't have rebar in the concrete, you don't want to drive a truck over you. You're going to crash and maybe die because the concrete will end up in your head. So what you have to do is you have to take things like Collagen Max, Mountain Red Velvet, and the cofactors that help you rebuild the bone, such as myco-D2 and tendon bender joint performance, so you're actually able to rebuild the cartilage in the bone, the hyaluronic acid, and the connective tissues. The trace minerals for bone would be in the Minerals Plus, as well as using things like NDMEs to optimize mineralization. And you can use technology such as lumen photon and micropulse Schumann resonance to actually increase bone density. And I've been using pulse magnetic field for 35 years to reverse bone weakness. It's very, very effective. The micropulse is less than $300 with our code, so you actually will save, I think, it's $40 or $45. And the lumen photon is an excellent technology that you can put over the areas and put it on the NICO setting, and you regenerate bone. She needs to have her bone regenerated before she assumes that they can put an appliance back in. Otherwise, it'll shatter and cause further destruction. So that gives you an idea. The way to tell if your bones are regenerating is you have subunits of collagen that will show up in your urine. deoxypyridinium and pyridinium subunits. The test is done through Genova Labs in Atlanta, and you can go to labtestingdirect.com, order the kit yourself. Then there's no charge from me, no co-payment or whatever. They'll send a test. It's a urine test. It can tell in 3 weeks if you're on our protocol. If you're stopping production of these subunits in your urine, it means you're rebuilding bone. After 6 months, you can repeat your DEXA scan, and it'll tell you if your surgical neck of your hip or an L4 vertebrae or whatever is weak, or a specific rib. It can identify any weak areas in your bone, and then you can put your lumen and your micropulse over those areas and take the right supplements and start a VibraFit. Because vibrational exercise compresses bone, piezoelectric crystals, and increases bone density. So I call it VibraFit with body elastic bands, so it gives you an idea of what we do. Let's see. That gives you some of our latest protocols and so on. I want to go over some of the latest wellness and nutritional news now. So we get some pretty interesting things. There's now a blood test to detect concussions. Just literally can tell you sort of right away. Concussions are actually very simple. They found a blood test that can actually find a biomarker called GEAP and UCH-L1, which are released in the bloodstream after head injury. These markers are released from the glial cells, or we call the glue cells. And the author is Dr. Linda Papa, PAPA, Emergency Physician Director of Clinical Research at Orlando Regional Medical Center. This is a good idea. It's published in JAMA Neurology. I'll have the article posted up so you can see the links over at Nutrimedical.com. We also have our news items over at Clay and Iron. All the news items are at ClayandIron.com. And we have, of course, our 5 channels, events channels now, but they'll be increasing their events for many other people, like people I have on periodically, like John Moore, other scientists, historians, whatever. You'll see a channel, and they're all free to go to that specific event and watch all the videos. But all the news is over on ClayandIron.com. My son Matthew is working on a very interesting paper that he'll be presenting, and that paper will be available, plus his talk here. We'll have him on soon to go over many issues. So back in a moment with